So more than one employer is invested in this effort, these two people especially. Have you had any troubles with kind of dividing out the time that the people work, or is that all real clear?
Well,
James, repeat the question.
yep. So the question was, if you have multiple employers, how do you divvy up the time that the success coach has, between the employers? And again, when we started out, we had companies of different sizes. We had one company with 65 employees. We had one with 700 employees. And the way that we structured it was none of the companies really knew how their employees were going to utilize it, because they all had different wage scales. They were all different sizes. They were in different industries. And so each company put in an equal share. And by doing that, they bought equal time. And so where the first center was really place-based, we had a physical brick-and-mortar center. Every one that we've done since then has been virtual, where the success coaches have dedicated time at each employer adjacent to the HR department. So I could be a 150 employee manufacturing company, and I get a success coach on site half a day a week. And I could be a 1,600 employee hospital, and I have the same half a day. And so because of buying a share, they have equal access that way. Some of the groups, once they've got through that first couple of years and they've tracked their performance, they've gone to more of a utilization model, where if I know that XYZ company is using 12% of the resources, they pay 12% of the budget next year. So it's done on that as opposed to revenue or a basic employee size.
I have a question regarding for-profit social enterprise. When you have a private sector company, mostly the bottom line is profitability and growth, right? For a social enterprise private sector company, I would think that you would have a bottom line of profitability because you have to make it profitable for yourself. At the same time, you have that mix with social enterprise and helping society. Now, how do you balance that, and what ends up being the priority and bottom line for profits, social enterprise company?
And I think, the example that Monica gave is Kaboom. They started out as a for-profit. They are basically haven't taken any money from anybody else, but they have a social mission. So because of where they're getting their funding from, they can have kind of dual purpose. They aren't trying to be, a multi-million-dollar profit. I think what's their size? Are they 20 million? Something like that. So they're a large organization, but because they've got this social mission, their driver isn't maximizing profit. Their driver is how many playgrounds can we create across the United States, using this investment from other companies that are investing in them as stakeholders. So again, by a social enterprise, and many of the people that I admired at the conference were for-profit people that got into the nonprofit or like an L3C type of a role because they wanted to use those processes to create change in the social sector. So,
thank you.
A question on this agricultural level, get paid parties involved. Did you have to train or sensitize the management of these different companies to understand the barriers that the employees will encounter?
Good question. So the question was, when you're working with, whether it's in manufacturing, in your example, agriculture, did you have to train the management as to being sensitive to some of the issues that the employees would deal with? So that is one of the things, we take a kind of an approach of, like you have continuous process improvement, we talk about continuous culture improvement. Many of the companies have a good culture, but they also have to look at how they can improve it. So what we did was, when we launched this program, we bring in the success coaches and we first have meetings with the supervisors to explain what the program is and why we're doing it. And, we've used Ruby Payne's hidden rules of understanding poverty to give the senior management, kind of a background as to some of the challenges that people from poverty or from different cultures might be facing. So it's more that socioeconomic diversity that we're looking at, as well as racial and their diversity. So, it gives them a framework that they can then understand some of the challenges the employees might be facing. And because they've got this resource now on site, they don't change the rules, but they, I think, are a little bit more willing to work with the employees. But yeah, it was definitely, each company has, especially the leadership, has this certain mindset of, well, why can't they just pick themselves up by their bootstraps like I did? And really to explain to them some of the challenges. And one of the pieces of analysis that we've done with all the companies in Michigan, we've had the companies take their employee list, put their 9-digit social security number into an Excel spreadsheet, and then we have a partnership with the state, and the state gives us back an analysis of how many employees within that company are receiving public assistance. So they don't get the names and stuff like that, but they get a sense. And in manufacturing, what we've seen is it's been about 8 to 12%. In long-term care, it's been like 18 to 22%. And in hospitality, because they're typically working less than 40-hour weeks, it's about 30%. So by creating that analysis, now the company understands, okay, if this is a situation, this is what the employees are dealing with. Not that I didn't know that, what am I going to do about it? So.
Say the name of the resource that you used to train management again.
There's Dr. Ruby Payne. Her initial work was Hidden Rules of Understanding Poverty.
Again?
Hidden Rules of Understanding Poverty. And in Merced here, you do have I think a Bridges initiative, which is based on Ruby Payne's work. And again, that was they've got the Bridges program, which is great for the individuals, but what we did was we took like a 90-minute class that we then had somebody trained to be able to go on site and to be able to provide this training to the employers so that they have a sense of, education in companies are typically run in middle-class mindsets. Some employees may be coming in with a poverty mindset. If we understand each other, then we have an opportunity to create a dialogue on how we can improve them. So.
Yeah, James. In the run-up, all the emails and the conference call we were having run-up to this.
Central Vista.
Yeah, all of that. All of that. Some of the things you talked about is, as you were setting up the mechanisms to make PRN work, was the difficulty in penetrating corporate mindsets or company mindsets in getting to the individual quickly enough. In fact, I remember when you said, we wanted to know if the employee was having a problem within 24 hours, and in fact, it'd even be better if we knew it before the ER department knew it.
Yep.
Because you're dealing with acute problems as opposed to a chronic problem.
Right.
Transportation, child care. It was immediate, and you needed to know right now. How did you break through that to get these companies to respond?
Well, I think, in any, corporate setting, companies deal with planned maintenance, and then they also deal with preventative maintenance. So we had to change our dialogue to reflect kind of the business, terminology. So, if you apply that same principle to employees, you may have chronic and you may have acute. The sooner that you can intervene on a failure, the greater likelihood you're going to be able to affect a positive change. And so, when we looked at that, and they saw how, moving forward the notification of some of those issues, from the employer side, delivered better results. The employers got more and more engaged with that. The company that I was with, Buttermilk Farms, we wrote in our HR timekeeping software a report that 15 minutes after the shift started, it generated a report and get emailed to the success coaches. So then they could take a look at that and say, okay, these 3 people didn't show up, and HR may not even know about it yet because we're not looking at that same report, but it gave the success coaches an opportunity to intervene. So not all companies were that proactive, but the companies that did want to, got to that level. On the employee side, when they, again, developed a relationship of trust with the success coaches, we had some success coaches that said, where before somebody in public assistance would hide, they wouldn't show up for work and then you wouldn't know about it, and the public system wouldn't know for 2 to 3 weeks after somebody lost their job. They now had employees calling them saying, Joyce, I didn't show up for work today, but let me tell you why. Before Joyce even had a chance to intervene, they knew that that resource was there and they had to account for those types of situations. So again, it changes the dynamic, and really, the employees see it as a way to give them the opportunity to maintain employment. And one last point, in West Michigan, because this wasn't being done before, and we actually created 10 jobs because we created this position. That was an additional staff position for the county, for the public sector. It was something that wasn't being done in the nonprofit sector, so we created 10 jobs by creating this opportunity.
So I have a question for you, Jay. Since you're up here, and we have you in town, and you live so far away, we can't afford to hire you. It's kind of a setup. So we have this workforce collaborative. We have a $30,000 grant partnered through United Way and the community colleges, and we're working with healthcare providers, the hospitals. We have 3 major hospitals in the county. And the goal is to do a lot what you're talking about. Work with human resources, work with the healthcare employees, one, for retention.
Yep.
And we can't do placement until we move these people up another notch. Once we move them all, retain them and move them up a notch and upgrade their skills, because we can use the funds for skills upgrade training,
Yep.
it creates a vacancy or slot down below, and then that creates a net new job. So if we do this grant and we're successful in that, will you help us do the next program with manufacturers instead of healthcare?
Sure. That's the exact same thing that we were dealing with. We had that revolving door in our HR department. And if we didn't stabilize that, we couldn't take the next step. And you read in the papers that there's a skill deficit. We've got plenty of workers at the unskilled labor side. When you get to the middle skill, there's a labor shortage. So we've got all these people unemployed, and you've got employers that have vacancies, and there's not a match. And so again, if you can build the relationship, with the employers and the nonprofits and government, and you can reliably retain those people, we as employers then have become more open to saying, okay, now that I know that I can retain somebody coming off of poverty, when I move somebody up, I'm more open to hire somebody from poverty because I don't have that bad experience of being quitted. So, it's got to be staggered, and the employer has to identify those needs, but it's also taking the opportunity to partner with the nonprofits, the educators, to be able to make that transition. So,
That's a great testimony. Let's thank James for his There is a great deal of frustration with service providers who want replacement and employers who want better people to hire. And the number one complaint I get is, oh, Dave, we just don't have a trained workforce, or we don't have a skilled workforce. Yes, you do. You just don't know where to look. So it's matching those resources together. That's where that frustration is created.